Okay, so we were talking about what changes takes place, what happens during these trimesters. Now, then we talked about the factors that affect the growth of the fetus, that is the growth of the baby inside the mother. These factors we talked about was the mother's emotional state, then the mother's diet, age of mother, medicines taken by mother, disease, germs, and disease and germs that affect the fetus, and drugs, alcohol, and smoking. Now, in text question 17.1, the fertilized egg is also called say again, Megan.
Ovum.
Ovum, no. A zygote. A zygote, okay. Ovum is only the egg which is not fertilized, okay. But zygote is like after the egg is fertilized, it is called zygote. Fetus is when it grows and it develops till the part where we can identify its body parts, like little hands, they start to form, and legs start to form, and head of the baby starts to form. Right. So when body parts are formed or body parts start to form, that time it is called a fetus. Okay. Yes. The zygote attaches itself to the lining of the uterus. Okay. To the lining of the uterus. I showed you all the diagram. Okay. The top portion. Okay, that was the uterus, the lining of the uterus where the zygote attaches itself and there only it grows. Okay. The vital organs like heart and lungs of the child start developing in the dash trimester of pregnancy. Second, yes. Second. Calculate the expected date of delivery for a woman who had her last menstrual period from June 15 to June 19, 2009. Okay. Now, yesterday I was teaching Megan that how we can actually calculate when the baby will be born. Okay. How that calculation is done is that suppose like I told you all that after the fertilization of an egg takes place, the menstrual cycle stops. Okay. The reason being that an egg is already fertilized, so it will not shed because it will develop into a baby now. Okay. So now from that period we count it. Okay. How do we count it? If her last menstrual period, that is before the fertilization, started on January 1, then we'll write down that date, January 1. To that, we will add 7 days. To that, we will add 7 days. It will become what date? January 8. Jan 8. Now, to Jan 8, we will add 9 months. 9 months. So, from January, count 9 months. From January, count 9 months. October. Okay. October. So, when we add to January 8, 9 months further, we get October 8. So around October 8, the baby will be born. Okay. Now this is an estimated date. The doctors use this process. The doctors use this process to calculate the date and give it to you. Okay. And we like expected by October 8, this can also be October 7 or October 9 or 10. Okay. Because it is approximate date and can vary marginally. Means very closely it can change. Okay. very closely, like 1 day, 2 day before, or 1 day, 2 day after, it is possible. Okay, normal. So here is the question. Here is the question. She had her last menstrual period from June 15 to June 19, 2009. Can you calculate and tell me what will be her expected date of pregnancy?
19th, 2010. I couldn't watch.
First,
Good
tell me.
question.
Yes, Megan, ask.
Do you count June or do you skip that month and then?
Okay. See, Megan, for example, her last menstrual period was from June 15 to June 19. We do not take when it is ending that date. We take when it is starting, that is June 15. Okay. So from June 15, we add 7 days to it first. Okay. So add 7 to 15. What date will come?
22.
22. Okay. We will have 22. So now 22 June, from 22 June to 22 July, 22 July to 22 August. Like that you have to add and see. Okay. So add 9 months to 22 June and tell me what will be the date or
March
what month it will
22nd.
be.
March.
March. Okay. We have 9 months. March. Yes, it will be March. Okay. It will be March and the date will be 22nd March 2010. Okay. We have June 15 plus 7 days. June 22 plus 9 months. March 22, 2010. Very good. So this is how you calculate the period or the expected date of delivery of the baby. Now this baby can come March 21 also, March 23 also. Okay. This is an approximate date. Okay. What happened, Megan?
I'm counting from June. I'm including June, June, July, August, September. I'm getting Feb.
You're getting Feb. Okay. Megan counted like this. June to July, July to August, August to September, September to October, October to November, November to December, December to January, January to February, and February to March. So this is my ninth block, and in the ninth, I'm getting March. Okay. You have to count, say like that June to July. Okay, like that would be your 1 month from 22nd June to 22nd July, 22nd July to 22nd August, 22nd August to 22nd September. Like that, you have to count. Okay, so that's gonna give you March 22nd, 2010. Okay. Okay. What are all the possible ill effects of having a child before 20 years of age?
The body isn't fully developed to have a baby yet, so the baby
Mm-hmm.
may have a lot of complications, and so will the woman.
Mm-hmm. Yes, yes, that is correct. Okay, because the body isn't fully developed. Okay, it is still developing by the age of 20. Okay, that is the physical consequences. Sometimes there is also emotional consequences when you are very young. Okay, maybe not very mature. Okay, when in the ages of 16, 17, 18, 19. Okay, we are like teenagers, not very mature. And then the having a baby is a big responsibility, that also physical as well as emotional, mental. Okay, so being mentally prepared for all of it, okay, is also challenging for young girls. So that is why it is said to have a baby for girls after 20. The best age from 21 to 35 years that we talked about yesterday for women. Okay, now given below is a set of statements describing the condition of some women. Name the women who may be pregnant and need to consult the doctor. Okay, five conditions are there. I'll read them. You tell me if the woman is pregnant or not. Mary feels nausea on smelling perfumes or dal or an odorous substance.
Pregnant?
She
I mean,
is
I don't
pregnant.
know.
Okay, because nausea is the first signs of pregnancy. Okay, it is one of the first signs you get in pregnancy, vomiting. Okay, the gut feeling and the insides will twist and the vomiting feeling. Okay, if you have experienced the fear that we have before we go for an exam, something in our stomach is twisting. So that is nausea, feeling of nausea, feeling of like that vomit and all. So that is there as the first sign. And then there is smell too. Okay, like smell because some senses are higher. Okay, so you are very sensitive to certain smells. Nina got married in October, and from November, she has not had her periods. Is that pregnancy or not?
That is.
Pregnant. Okay,
Yeah.
I think she is pregnant.
Yeah.
This is also one of the first signs. Okay, that but like from November. Okay, maybe I don't know in the
Yeah.
1 month gap how. I'm not like sure about this one. This is in text question 17.1. Let me check it out. 17.1. Might be pregnant, Meena and Sheila. Okay. Jasvinder is not consult a doctor. Mary and Pinky have to consult a doctor. Meena and Sheila might be pregnant. Let's see the names. Where are the in-text questions? Okay, here. Okay, yes. So this she might be pregnant. Okay. She might be pregnant. This one. Okay. Then Sheila is scared to get up in the morning. If you are unsure about your answer, you can just write might be pregnant. Okay.
Yeah.
It will be considered a correct answer. Like in this one, if you feel a little uncertain, but you're also sure because signs are there. Okay. So you can just write might be pregnant.
Okay.
Okay. That will be your correct answer. Okay. Sheila is scared to get up in the morning because as soon as she brushes her teeth, she vomits. Okay. This is also possible that she might be pregnant or not because brushing the teeth can be like some issue with like her teeth or throat or something like that. Okay. That she is vomiting. Okay. So might be another issue or might be pregnancy also. So might be pregnant will be the answer. Okay. Right. Jaswinder has been menstruating every 28 days, not pregnant. Okay. Cycle is regular, not pregnant. Pinky needs to gulp an antacid after every meal. Okay. I think she has some acidity or something. So she needs to consult a doctor. Consult the doctor. Okay. Consult the doctor. Now, caring for a pregnant woman, which is known as prenatal care. Yesterday I explained that natal, the word natal means birth. Okay. We know pre means before and post means after. So the period before the baby is born, okay, before the birth of the baby is known as prenatal period. Okay, all the pregnancy period is known as prenatal. After the baby is born and the period, the weeks after the baby is born, is called postnatal period. Okay, postnatal period. Now, you are now familiar with the signs of pregnancy and know about the major changes that take place during the 9 months of pregnancy. With a rapid growing fetus in her womb, the pregnant woman experiences physical and emotional stress during this time. It is important for every woman to take care of her health throughout her life. She becomes extremely vulnerable during the period of pregnancy and childbirth. Therefore, she needs a lot of support from the people around her. You must have seen the concern shown by all the family members of a family, neighborhood, and the community in general. They advise the pregnant woman to not do or to do or not do certain things. This advice may be based on local practices and customs. Therefore, it may be best to consult a trained professional before acting on any such advice. During pregnancy, the family must ensure that the following are taken care of. Okay. Now, in the pregnancy period, there is a lot of things that a woman should and shouldn't do that the people around her say they take care of her and all. Okay, she cannot lift heavy weights. Okay, if she will lift heavy weight or she will push something or lift heavy things, then what will happen? It will directly, the impact will come on the baby, okay, inside the belly. Yeah. So certain things are there that women shouldn't do. Okay. Also, like lie on the stomach flat. Okay. And bend in a wrong position or something. Okay. Because it might strain the stomach. Okay. Strain the womb because baby is there. So how or what things the family must do to ensure that she is taken care of. Okay. First comes medical checkup. After the first missed period, the lady becomes anxious to know if she is pregnant. This can be done with a simple urine test done by the doctor during her first visit to healthcare to the health center. Kits to test pregnancy at home are also available with chemists. Okay, pregnancy test kits are there. Okay, which uses some drops of urine to check if she is pregnant or not. Okay, there's a line, like two lines are there, then pregnant. One line is there, not pregnant. Okay, because see, we know that a lot of hormonal and chemical changes happen inside the woman's body. Okay, so and our urine in general has a pH. Okay, has a pH. You know what is a pH, right? Particular like type. Okay, and when that changes in the body happens, that pH seems to change. Okay, the hormones are there, everything is there, so it is used as an indicator to check if she's pregnant or not. Okay, now it is extremely important for all pregnant women to go to a doctor for a proper medical checkup. If a doctor is unavailable in the area, a trained midwife or someone or some other trained health professional can be consulted. Okay, consultation from the doctor is very important. Okay, and checkups. Regular checkups are very important to check how the baby is doing inside. Okay, what's the condition of the baby, if any complications are there or not, everything is okay or not. Okay, so regular medical checkups are very important. If you live in a village, seek the help of an Asha or Anganwadi worker. Okay, these are women who work in the village and support. Okay, she will take you to the nearest health center. At the healthcare center, pregnant women should not hesitate to consult the doctor available, whether male or female. Okay, if you are having something like something different, or you're feeling some complications, some pain is there, something is there, you have to go see a doctor. Okay, and clearly tell the doctor that this thing I'm feeling. Okay, that this pain is there, this is there. They should always tell the doctor. Now, the doctor ensures that a pregnant woman undergoes some routine blood and urine tests. These are hemoglobin test for anemia, blood group for transmission of blood if required, blood sugar for diabetes, VDRL test for sexually transmitted infections and HIV and AIDS. Okay, now hemoglobin, okay, which is blood. Okay, if it is less, then she might be anemic. Anemia is a condition where your blood in the body, or the red blood cells, the hemoglobin, is less in quantity than it should be. Okay, it's lesser than in quantity than it should be. And when you have a baby inside, yesterday I was teaching about placenta. So from the woman's bloodstream, the baby gets all its nutrients. Okay, and it is very important for the mother to have good hemoglobin, good healthy body. Okay, all the blood cells should be there. Okay, then if blood group, sometimes what happens when the baby comes out at the time of delivery, a lot of blood the woman loses. A lot of blood the woman loses. If she loses a lot of blood, then you have to put the blood into her body through drips. Okay, you put the blood into her body through drips. So, and certain blood type can only be given to certain blood types, as you know, right? We cannot, like, blood groups are there. Blood groups are there such as A positive, AB positive, O positive, O negative, okay, B positive. All of these blood groups are there. Okay. Now what happens is that if, like, blood groups, you cannot randomly take A's blood and give it to B, B's blood give it to A. Okay, you cannot randomly do that. Okay, they need a matching. Okay, we need to match the blood groups and give. And O is a blood group which is a universal donor. I think it's O positive. Okay, which can donate to all the blood groups. Okay, and one of these, I cannot remember which one, is the one who can take blood from any. Okay, so you can study more about it. Do you know what are
I
your
think
blood groups?
I'm B
Yes.
positive.
You are what? O positive,
B positive.
B positive. Okay.
But I
Megan?
think the one that can give the blood to anyone, I think it's O positive. I'm pretty sure.
Yes. Yes. Who can go give to anybody is O positive, probably. That's what I've heard too. Do you know, Megan, what's your blood group?
A positive.
A positive. Okay. Mine is AB positive. So these are the blood groups. So that is why when the mother needs extra blood, we have to know in advance what is her blood group, so that she can be given the blood if the blood loss happens. Then blood sugar is diabetes. Okay. Diabetes, plays an important role in a lot of diseases. Okay. There is diabetes, a lot of treatment, diabetes. Okay. It is given according to that. So diabetes, blood sugar is also checked. Then VDRL test. Yesterday I taught that pregnant women can catch sexually transmitted infections, okay, which can harm the baby, which can also harm the baby. So, VDRL and HIV/AIDS, for any infections, it is tested. Okay, these are all the tests done. Her weight is measured, and she is given an injection for tetanus. Okay, tetanus is how to say it to you, kind of an antibody, okay, that keeps you away from infections, from spreading of infections. Okay, the same is given when you when a dog bites you. Okay, when you get a claw of a dog or a cat or something. Okay, or when you get a scratch from a steel or something. Okay, because germs come in and the germs they spread in the wound. So to avoid those things, we are given tetanus injection. This ensures safe motherhood and delivery. A visit to the doctor at least once a month for the first 8 months of pregnancy and once a week during the last month is a necessity. Okay, every one time every month for 8 months and last month every week. Okay. Figure 17.7 indicates a pregnant woman being examined by a doctor. She may need to consider the dog more frequently in the first trimester because of various problems she may have. There is 17 point, okay. Here is 17.7 medical checkup during pregnancy. Okay. Now, these days, the doctors may devise ultrasound test or sonography to check for any abnormalities in the growth and development of the fetus. Okay, ultrasound, they use sound rays. They use sound rays to check if the baby is okay. Okay, if any complications are there or not, any disformity, anything is there or not. They check it using ultrasound. Sonography is also done. Okay, where it is checked the abnormalities in the growth and development. If anything is there, by using these two things, we check it. Some patients and doctors misuse this facility to determine the sex of the fetus and terminate the pregnancy if the fetus is found to be female. This is known as female feticide. The practice of female feticide has led to a serious decline in the number of baby girls being born in our country. Okay, this I was telling you about that there are techniques. Okay, there are techniques and they are like known as they are known as prenatal diagnostic techniques. Prenatal diagnostic techniques. What happens that what is the gender of the baby? If it is a male boy or a girl, that people try to know before it is born. Okay, and if they see that it is a girl, then they kill it inside the mother only. Okay, they kill the baby girl inside the mother's womb only. Okay, when it is a fetus. Yes, Megan.
Isn't it illegal to do now?
Yes, Megan, it is illegal to do now. Okay, it is illegal to do now, but they do it in some rural areas, some places it is still done. Okay, I wouldn't say that it is fully eradicated or it is fully, the practice is fully over. No, some places they still do. Okay, if not feticide, they do female infanticide. Okay, what is infanticide? The baby is born when it is an infant baby girl, then they kill it after it is born. Okay, that is a practice called female infanticide. Okay, now there is an act called Prenatal Diagnostic Techniques Act. Okay, Prenatal Diagnostic Techniques Act (PNDTA). Okay, which prohibits the use of these prenatal diagnostic techniques to determine the gender of the baby. Okay, and this also regulates the hospitals if they have proper licenses or not. Okay, if they are you doing these practices or not. This act regulates them. It is important under this act. It is important for medical care centers to have proper license. Okay, then you can only check for deformities and all for it you can determine what gender it is. Okay, that is there what the act regulates. Okay, Prenatal Diagnostic Techniques Act is made by the government. Now, The practice of female feticide has led to a serious decline in the number of baby girls. Okay, the ratio of male to female, the ratio of female is very low in some places. Okay, in our country also, not really no really low now, but earlier. Okay, earlier this practice was way too much. Okay, now still less, but in rural areas, some places it is still there, and it leads to decline in the number of women, in the number of girls in the country, in the places. Okay, so this is there. Now, this has a serious negative social impact, as is seen in the increasing incidence of violence against our sisters and daughters. Okay, violence is there. Okay, increasing violence is there because our society encourages males to be more dominant, males to be more powerful, and they treat women as nothing. Therefore, because the boys, young boys, when they grow with that mentality in the society, they think women, they objectify women, okay, and they do what they want with them. If they are grown in a society with such a mindset which considers women inferior to men, then they objectify them, treat them the way they want to. Okay, because the society is not teaching the men that women are equal to them. Okay, that boys and girls both are equal. So this should be taught, okay, in the societies that both are equal, both are equally important. Okay, both are equally important. Then every child conceived has a right to be born. This is an important human right. It is our duty to promote and advocate this right and reduce the gender bias in our country. What is gender bias? Gender bias means um, differentiation, differentiation on the basis of gender, or unfair treatment, unfair treatment on the basis of gender. Okay, like if she's a girl, she's treated badly. If it is a boy, he's treated very good. That is gender bias. Okay, unfair treatment on the basis of gender. So this should be reduced. Okay, this should be reduced, and every child who is conceived has a right to be born. Okay, if you don't want it, then there are measures to control pregnancy. Okay, there are measures to control pregnancy. But what people do instead is not control it prior, but later they indulge in feticide and infanticide and practices. Okay, which is a wrong thing to do. Now, okay, tomorrow we will talk about the topic of nutrition. Tomorrow we will talk about the topic of nutrition. Okay, we'll stop here for today. Today we covered medical checkup. Okay, the first part we covered the feticide and infanticide and some questions. Tomorrow we'll talk about how nutrition is an important part for pregnant women. Okay. Okay. So in just some time I'll send you all the English test. Okay. You can send it to me today. Okay. Please do it and send it to me today. Anytime today. Okay. Evening, night, anytime today. And we'll meet for the classes tomorrow. Okay.
Okay.
Okay. Bye, all. See you
Bye bye.
tomorrow.
Thank